This video will help you understand whether you are a good candidate for total hip or knee replacement. In general, you should meet the following 3 criteria. First of all, you should have a problem about your joint, about your hip or knee, that's severe enough in regards to pain or limited mobility to warrant a joint replacement. This should be confirmed by your total joint orthopedic specialist. Second, you should have failed some non-operative treatments surrounding your joint pain prior to proceeding with surgery. This includes the use of physical therapy, activity modification, oral anti-inflammatory use, and sometimes injections, particularly around the knee. Last, and quite important, is that if you are to proceed with surgery, you must understand the risks and benefits around the procedure and feel comfortable with them. So while these procedures are very common, more than 1 million people a year in the United States having them done, there are significant risks. This includes serious things like heart attack or stroke, and more common complications like infection, blood clot, nerve or blood vessel damage, limb length discrepancy, joint stiffness or instability, or fracture of the bone. Of course, your surgical team will take care of all of these, and most people do very well. So, understand that if you have a serious problem about your hip and knee, if you've failed non-operative treatments, and you're comfortable with the risks and benefits of surgery, it may be appropriate for you to proceed with surgery. Now let's talk about a hip or knee replacement and its benefits. First of all, hip and knee replacements are very powerful surgical procedures that can help restore one's mobility and decrease pain. They are applied to people who have significant degenerative disease of their hip or knee. Most people do quite well with these, although there are some risks that we will tell you about. Let's talk about knee replacement briefly. In a knee replacement, an incision is made over the front of the knee. The ends of the bones, both the thigh bone and the leg bone, are resurfaced with metal, and a plastic piece is placed in between. A number of different implant types are used, and at your initial consultation, you can discuss these with your surgeon. Now let's talk about hip replacement. A hip replacement includes the resurfacing of the socket of the hip and a replacement of the ball of the femur. A hip replacement implant is placed in one of 2 ways, either from the front of the hip or through the posterior aspect of the gluteal muscles. Again, talk with your surgeon about the surgical approach that may be used and the different types of implants.